Preparing for the CPSP TOACS Radiology exam. This comprehensive guide will walk you through everything you need to know to ace this task-based exam. From key radiological areas like chest, abdominal, and neuroimaging to practical tips for mastering time management and communication skills, we've got you covered. Whether it's static stations or interactive scenarios, get expert advice on how to approach each station with confidence. Don't miss out on these crucial strategies for success in the CPSP TOACS exam. Topics covered: TOACS format breakdown and expectations, key radiological subspecialties to focus on, expert tips for time management and communication, core competencies evaluated, data collection, diagnosis, and more, how to handle exam stress and prepare effectively. 1. Introduction to TOACS and Radiology. Task-oriented assessment of clinical skills. TOACS is a structured clinical exam designed to assess core competencies in radiology. CPSP uses TOACS to ensure that radiologists are capable of handling real-world clinical scenarios. This format evaluates practical and decision-making skills by placing candidates in controlled, task-based environments where they are required to perform specific radiological tasks and explain their thought processes. This exam format is particularly advantageous because it moves beyond theoretical knowledge to practical, task-based performance. It allows examiners to observe how radiologists interact with clinical scenarios under pressure. Stress that TOACS is similar to an objective structured clinical examination, but it's tailored more towards problem solving and performing clinical tasks in radiology. 2. Exam format overview. TOACS typically consists of two types of stations: interactive stations. At these stations, candidates are required to perform clinical tasks such as interpreting radiological images or discussing a treatment plan with a colleague or patient. After performing the task, examiners ask follow-up questions to assess the rationale behind the candidate's actions. Static stations. In these stations, candidates might be presented with pre-prepared scenarios or images where they are required to interpret findings, make clinical judgments, or solve problems without interacting with an examiner. The total exam duration can vary, but it usually consists of several 5 to 10 minute stations where candidates rotate between different clinical tasks. Explain that each station tests a specific clinical competency, such as interpreting a chest X-ray or diagnosing an abdominal issue using ultrasound. 3. Core competencies evaluated. Here, break down the key competencies CPSP evaluates during the TOACS exam. Data collection and interpretation. Candidates must show their ability to gather relevant patient history, examine clinical symptoms, and interpret radiological images. This could involve taking a brief history from a simulated patient or interpreting imaging findings from various modalities like CT scans or MRIs. Differential diagnosis. Candidates should demonstrate that they can form logical differential diagnoses based on imaging results. For example, when presented with a chest X-ray, they must differentiate between common conditions such as pneumonia, pleural effusion, or malignancy. Clinical decision-making. This involves not only identifying radiological findings but also planning the next steps in patient management. For instance, after identifying a mass on an abdominal CT scan, the candidate may need to suggest further imaging or a biopsy. Communication skills. Radiologists must communicate their findings effectively to both medical staff and patients. This could be tested through role-play scenarios where the candidate needs to explain complex radiological results to a patient in layman's terms. Professionalism and ethics. The TOACS also assesses how well candidates maintain professional standards, especially regarding patient confidentiality and ethical decision-making during radiological procedures. 4. Key radiological areas to focus on. In this section, dive into the specific radiological subspecialties that candidates should focus on. Chest radiology emphasize interpreting chest X-rays and CTs, which often involve diagnosing lung conditions such as infections, for example, pneumonia, pleural effusions, and neoplasms. Candidates should also be familiar with recognizing acute respiratory distress syndrome, ARDS, or pneumothorax. Abdominal imaging. Explain the common use of CT and ultrasound in abdominal cases. Candidates should practice interpreting images for common conditions like liver pathologies, appendicitis, or gastrointestinal blockages. It's important to discuss how to differentiate between benign and malignant masses on abdominal imaging. Musculoskeletal imaging. Focus on fracture interpretation using X-rays and MRIs. Radiologists should also understand joint pathologies like osteoarthritis and bone tumors. Emphasize how to spot common fractures, such as in the wrist, Colles fracture, or ankle, Weber fractures. Neuroimaging. Discuss the key findings in CT or MRI scans of the brain, especially in conditions like strokes, traumatic brain injury, or tumors. Candidates should also know how to recognize signs of raised intracranial pressure or brain hemorrhage. Pediatric radiology. Introduce the special considerations needed when imaging children. Discuss congenital abnormalities, infections like bronchiolitis, and developmental disorders. It's also important to highlight the need for appropriate imaging techniques that minimize radiation exposure in pediatric cases. 5. Common challenges and how to overcome them. Candidates often face challenges due to the time pressure at each station and the need to justify their decisions clearly. Encourage viewers to stay calm and methodical during each station. Rushing can lead to errors, especially in image interpretation or decision-making. Practice interpreting images within a set time frame to simulate the exam environment. Engage in mock exams. Simulating TOACS by working with colleagues or mentors in a timed environment helps build confidence and speed. Practice explaining findings concisely and clearly. Know how to handle both static and interactive stations. For static stations, focus on image interpretation and rapid clinical decision-making, while for interactive stations, practice communicating with patients or examiners to hone interpersonal skills. 6. Final preparation tips. Revise key radiology texts and clinical guidelines. Ensure you're up to date with current standards in radiology, as CPSP often bases questions on recent clinical guidelines. Attend review workshops. These workshops, often offered by radiology departments or examination preparatory groups, can provide a good simulation of the TOACS format. Some CPSP candidates have found structured workshops incredibly beneficial in building confidence. Stress management. Finally, remind viewers to take care of their mental health leading up to the exam. Proper rest, regular study schedules, and some relaxation techniques will help alleviate exam stress. By following this structured approach to preparation, radiologists can maximize their performance in the TOACS exam and demonstrate their competencies effectively under the challenging CPSP format. Subscribe for more tips and resources for radiology exams.